So the presenter I'm introducing today is Zain Shabbir, and he is the current incoming sophomore at UC Berkeley studying chemical biology. And a fun fact about Zain is that he has a huge passion for Formula One.
Hi, everyone. My name is Zain Shabbir, and this summer I had the opportunity to work with Mr. Henry Ocampo and Dr. Marsha Treadwell of Benioff Children's Hospital Diversity, Equity, Inclusion, and Anti-Racism Council, researching NRC health patient experience survey data from fiscal year 2022. To provide some background regarding my project, the current basis of literature currently illustrates that racism is a public health crisis that drives significant degrees of health inequities and puts minorities, especially BIPOC populations, at a greater risk for poor health outcomes. So this report essentially aims to analyze discrepancies in self-reported healthcare experiences based on patient data, dependent on patient race, ethnicity, and language. Our research report had two arms. The first was a quantitative analysis, and the second, a qualitative analysis. So first, beginning with our quantitative analysis from fiscal year 2022, we essentially took all of our data and aggregated overall scores based on the patient survey data for all the following categories and criteria on the left. After doing so, we then stratified data based on race and ethnicity, and then determined score differentials, assigning scores for each race that were lower than the overall average mean with red, and the blue scores are the scores when the racial average was greater than the overall average for all races combined. Now, analyzing the Asian, Black, and Latinx population and comparing that with the white populations, we clearly see that there's a difference in the overall healthcare experience, with Asians, Black, and Latinx populations generally reporting healthcare experiences that were worse than the mean experience when compared to white populations, with a lot more blue, indicating an overall experience that was more positive than the average patients. So ultimately, our quantitative analysis indicated to us there was a difference between the overall healthcare experience for BIPOC populations when compared with white patients here at Benioff Children's Hospital. However, it failed to provide an actual story behind the data, which led us to our qualitative analysis. Specifically, our qualitative analysis focused on the courtesy and respect question on our NRC patient surveys, where patients were given the option to rank their overall understanding of courtesy or respect from 0 through 10. Patients who had given us a score of 0 through 5 were considered detractors, and their comments were extracted for further analysis. Specifically, from a pool of 5,069 overall comments, we extracted 487 negative comments for further analysis, of which these negative comments were divided into systemic categories related to things like wait times or hygiene, and interaction-based or non-systemic categories. These non-systemic categories were further divided into 4 key subcategories. The first was disrespect, the second, demeanor, the third, discrimination, and the fourth, language-based discrimination. Analyzing the methodology for the Latinx and Hispanic experience, we started off with a pool of around 2308 patients, out of which 155 or 6.7% gave us a score of 0 through 5. From here, we stratified these patients independently and then categorized them according to our 5 key categories, illustrating this data in a pie chart to better understand our distributions of each of the 5 categories. So analyzing now the 6 major racial and ethnic groups here at Benioff Children's Hospital in San Francisco and Oakland, we see a couple of key takeaways. The first is that largely the largest category overall in almost all 6 racial and ethnic groups was a systemic category, ranging anywhere from 50% to upwards of 60% of complaints of 0 through 5, with an exception of the NHPI category, which largely only had 5 individuals in the sample size. However, we say the second key takeaway is that for 4 out of the 6 major racial and ethnic groups, demeanor-based complaints were the most common in nature. And lastly, if we look to the Latinx pie chart here, we notice that language-based discrimination was a unique complaint to the Latinx population, thus providing some key quotes that were extracted from patient survey data in order to provide a better understanding of each of these 4 key themes. We said in terms of disrespect, we noticed that some patients experienced a degree of disrespect from judgmental and rude providers who they say, quote, didn't show any respect for them as a person. In terms of demeanor, we see that patients generally report experiencing a non-warm healthcare environment when they walk into a children's hospital, come to expect a warmer environment than what they really did experience. In terms of discrimination, we noticed that African-American patients often complained of discriminatory behavior due to their vaccine status, specifically in regards to the COVID-19 vaccine. And lastly, in terms of language discrimination, we observed that Latinx population oftentimes observed a lack of education surrounding data associated with translation and transcription services here at Benioff Children's Hospital. Thus, turning to the key conclusions of our project here over the summer, we noticed firstly that BIPOC patients had greater non-systemic negative comments than white patients overall. And secondly, that our results suggested that targeted education on the appropriate use of interpreter services to address systemic racism is needed to improve patient experiences of BIPOC patients across all BCH campuses, San Francisco and Oakland. At the end of the day, our primary goal was to hopefully optimize the patient experience for everyone involved, including staff, providers, and patients, to create a better hospital for all to come to. Thank you very much.
Really interesting, Zain, and so important for clinical care and optimizing clinical care and the patient experience. Michelle, you got the first question.
Hi, first of all, you did like an amazing presentation. It was like really great, and I really enjoyed the topic. And I had a question about the targeted education. So have you guys discussed how that would take place? Would it be in the form of implicit bias trainings that have like a specific theme, or would it just be like continuous, like maybe like readings or like assignments for healthcare providers to work on?
It definitely involves quite a bit of that, and that's actually the next further step for our project, in that we have a bit more of a complicated version of these very same slides. Obviously, these slides are distilled for a 5-minute presentation, but there's a couple of slides that we have that are a bit more in-depth that are actually going to be presented to the providers at Benioff Children's Hospital, to which we're going to illustrate these same key themes to them, such that we're going to focus on things like implicit bias training to hopefully reduce systemic racism on campus, but beyond that, also increase and provide education to staff in regards to better accessibility for things like translation service and transcription services, and additionally, things you were mentioning, things like systemic bias training and readings to help hopefully mitigate some of these negative experiences.
So Zain, what's your thoughts on why the Hispanic group had more issues related to language barrier than maybe other groups? Are there any considerations around why that might be perceived?
I think, at least based on our understanding, I was just with my mentors, Mr. Henry Ocampo and Dr. Marsh Treadwell, it largely had to do with sort of language-based barriers being more common in these communities, specifically due to a larger portion of the Latinx population being immigrants when compared to something like the Asian population or the African-American population, where in terms of sort of a lack of English-speaking populations, when the primary language in many of these immigrant populations is Spanish. So because the primary language is Spanish, there was a significant degree of complaints in regard to language-based discrimination, which were more commonly experienced among the Latinx population when compared to, let's say, the African-American population or the other previous BIPOC population we discussed earlier.
And was there not a secondary question that was asked about immigration status? Probably, I would guess not.
There was not.
Tease that part apart. Okay, yeah.
Yeah, there definitely wasn't, but that could have definitely played a role. I would surmise that definitely could have played a role, specifically in regards to why we see some of these unique complaints regarding language discrimination solely isolated to the Latinx population.
Excellent. Yeah. Neat. That's really great data, and so rich. That'll be fun to explore a little bit further. Nicely done.